Why do stomach ulcers keep coming back? Imagine having a sore that keeps healing and then reappearing. That's often what happens with stomach ulcers or peptic ulcers. They tend to come back because of ongoing factors that keep damaging or preventing healing of the stomach lining. The main reason is infection with a bacteria called Helicobacter pylori. This bacteria is responsible for most stomach and duodenal ulcers. If it's not fully eradicated with the right antibiotics, the bacteria remains, causing persistent inflammation and weakening the stomach's defenses. Studies show that when H. pylori is not completely treated, the chance of ulcers returning is over 50%, but if it is successfully cleared, recurrence drops below 10%. Another big factor is the continued use of non-steroidal anti-inflammatory drugs, or NSAIDs, like ibuprofen and aspirin. These medications block prostaglandins, which are natural protectors of the stomach lining. Without enough prostaglandins, the stomach becomes more vulnerable to acid damage. People who keep taking NSAIDs after an ulcer often see it come back. This risk is even higher in older adults, those with previous ulcers, or people taking other medications like steroids or blood thinners. Smoking also plays a major role. Nicotine reduces blood flow to the stomach lining, making it harder for ulcers to heal and increasing the chance they will return. Smoking also decreases mucus production, which normally protects the stomach from acid. It relaxes the muscle between the stomach and esophagus, which can cause more acid to reflux and worsen ulcer conditions. Quitting smoking can significantly lower the risk of ulcers coming back and prevent complications. Other factors can contribute too. Use of steroids or certain medications can increase risk. Stress-related ulcers may recur if the underlying stress or health issues causing poor blood flow continue. Rare causes like Zollinger-Ellison syndrome, a condition where the stomach produces too much acid, or other chronic illnesses, can also lead to recurrent ulcers. As we age, the stomach's defenses weaken because blood flow and protective substances decline, making older adults more prone to recurring ulcers. Incomplete treatment is another common reason. If H. pylori is not fully eradicated, or if acid-suppressing medications are stopped too early, ulcers can return. Regular follow-up with a healthcare provider is essential to ensure proper healing and to manage ongoing risk factors. Preventing ulcers from coming back involves a few key steps. First, completing the full course of antibiotics to eliminate H. pylori is crucial. Patients should be tested again to confirm the bacteria is gone. Avoiding or carefully using NSAIDs is also important. When necessary, doctors might recommend protective medications like proton pump inhibitors to reduce stomach acid. Quitting smoking is highly beneficial, as it improves healing and reduces recurrence. Regular medical checkups help monitor healing and address any ongoing issues. Managing other risk factors, such as stress or medication use, under medical guidance, can also make a big difference. In summary, stomach ulcers tend to recur mainly because of persistent H. pylori infection, ongoing use of NSAIDs, and smoking. Effective prevention depends on eradicating the bacteria, avoiding ulcer-causing medications when possible, quitting smoking, and working closely with healthcare providers to tailor treatment to individual needs. Always consult a healthcare professional for personalized advice and proper management to keep those ulcers at bay.